my name's Heather, and today we are going to give a persuasive speech. I'm going to go ahead and introduce my audience. This is Michelle, Paul, Clifford, Tina, and Jarrett. I'm going to give the camera back. And just wanted to point out my note cards I have here. This first one, it says preventable diseases plus preventable healthcare equals a healthier you. Alright. My friend Anne felt as though she was leading a fairly healthy lifestyle. She consumed a healthy diet for the most part and was quite active outdoors. When she began her new insurance plan, they offered a few screening tests at no extra cost to her. So she thought, why not? When her results came back, she was shocked to find out that she had a fasting blood glucose level of 115, placing her in the bracket of prediabetes. Today, I would like to persuade my audience to take advantage of the preventative health services offered at their doctor's office. As a healthcare professional, witnessing the diagnosis of preventable diseases is common and very despairing in each situation. My audience should take advantage of the preventative health services to give them peace of mind in knowing their current health status, identifying health problems early so they can be treated, and not develop into chronic conditions, and to decrease the overall cost of healthcare as it's more cost effective to prevent a disease than it is to treat it. Let us begin by talking about what preventative healthcare is and some of the benefits it has to offer. What is preventative healthcare? Preventative healthcare is a type of care provided by your primary care physician to aid in the prevention of illness or disease. According to USA Today, the sole purpose of preventative health services is to keep you healthy and to extend your lifetime. USA Today points out that many of us don't think twice about going to the doctor when we're sick. What many of us fail to realize, though, is that with preventative measures, many illnesses can be prevented. They point out that the occurrence is more common in young adults as they aren't as concerned with their health. Preventative healthcare measures can give you peace of mind in knowing your current health status. According to the CDC, potentially preventable chronic diseases account for millions of premature deaths in America annually. The top 5 leading causes of death in the United States include heart disease, cancer, chronic lower respiratory disease, stroke, and unintentional injuries. A few of these diseases have a genetic predisposition, meaning that your likelihood of developing a particular disease increases if you have a parent with the disease. By taking part in preventative healthcare services, you can detect your chances of acquiring the disease and take the necessary steps to prevent it. The CDC goes on by saying that the benefits of preventative care not only benefit younger generations, benefit not only us, but younger generations as well. When we practice preventative care, children grow up in communities, homes, and families that support healthy development. Now that we've discussed what preventative healthcare is and the peace of mind it can offer you and your loved ones, let's discuss the tools the service offers to keep you healthy. What diseases are considered preventable? When you maintain your health, you are able to identify health problems early before they develop into chronic problems. According to USA Today, the top 5 preventable diseases include heart disease, cancer, diabetes, mental illness, and vaccination preventable infections. The CDC states that chronic diseases such as heart disease, cancer, and diabetes are the cause of 7 out of 10 deaths in America each year. In a journal article published by the Australian and New Zealand Journal of Psychiatry, the article discusses a clinical program that made referrals for young individuals who are considered high risk for developing a psychotic illness. The concluding results revealed that with these early referrals, a long period of time elapsed between the start of symptoms and the initiation of help seeking. According to social science and medicine, education is key in enhancing the demand for preventative health services by raising awareness of the importance in regular health screenings. What screening tests are available today? According to USA Today, routine blood tests are key in diagnosing heart disease and diabetes. Various cancer screens such as mammograms, colonoscopies, digital exams, and pap smears aid in diagnosing cancer in different regions of the body. Staying up to date on vaccinations is important as they play a crucial role in decreasing your chances of acquiring serious infectious diseases. Unfortunately, mental health isn't treated the same as physical health. However, your clinician has the proper screening tools to better assist in treating you. Now that we've discussed the types of preventable diseases and the screening tests available to detect them, let's talk about a few barriers that deter individuals from preventative services. Several individuals shy away from participating in preventative services due to the financial burden that it could impose. Many are unaware that it's more cost-effective to prevent a disease than it is to treat it. In an article published by the Institute of Public Affairs Review, the article discusses how an increased emphasis has been placed on the preventative services due to the cost-effectiveness that they provide. According to the CDC, many American families go without receiving preventative services regardless of having insurance. Even with the insurance, the costs associated with co-payments and deductibles are expenses that could put them in a financial bind. The CDC goes on to state that the health issues that individuals experience place a financial burden on the economy. Each year, 69 million workers miss work due to illness, which negatively impacts economic output by $260 billion. If we were to increase the use of preventative health services, we can increase workplace productivity. What can you do to stay healthy and keep more money in your pocket? The CDC recommends checking with your insurance company. You may have little to no out-of-pocket costs for preventative screenings to detect disease early. According to healthcare.gov, it's mandatory for most health plans to cover preventative health services with no out-of-pocket cost. This includes plans available within the health insurance marketplace. As we near the conclusion, I hope the information I've shared with you has shed some light on the many benefits of preventative health services. The importance of taking part in preventative healthcare services makes all the difference when it comes to your health and longevity. By taking part in the services, you will know where your health stands, diagnose health problems early before they escalate, and ultimately decrease the amount of money spent out of pocket. As for Anne, she scheduled an appointment with her primary care physician to discuss healthy food choices and an exercise regimen that suited her. After 6 months, Anne was successful in reducing her weight and normalizing her blood sugar levels, so she was no longer considered pre-diabetic. Now that you know the importance of preventative screenings, it's time to take action. When will you schedule your next preventative healthcare visit? Some of the sources that I used were from the Institute of Public Affairs, USA Today, Australian and New Zealand Journal of Psychiatry, the CDC, healthcare.gov, and the Social Science and Medicine Journal. Thank you.
Thank you, Heather.